Yes, John, there are more than 400 delegates going to be here over today and tomorrow. Their hope is to find a blueprint to answer some of the many, many unknowns about this virus. But as you just said, there is one known now. They have finally today named it Covid-19. It means coronavirus disease 2019 for the year. It was discovered in December in Wuhan and Hubei province. This is a brainstorming session, and they don't happen very often. We saw it with the Zika virus when there was an outbreak in Brazil, and we certainly saw it for Ebola in 2014. What they want to do is put these fine brains together and try and find out a way of stopping the spread further. Now you can see the flags behind me. This is all about countries helping each other and helping China as well, not let it go further beyond the borders. And there is now a WHO team who has just arrived in China earlier this week. This is, in many ways, the very essence of global collaboration. Even the finest brains need feeding, so the tea break in between sessions on how to deal with the novel coronavirus is a mix of canapes and case fatality ratios, a blend of the knowns and unknowns. And there are many unknowns, but at the end of day one, the message from the World Health Organization was uncompromising.
You know, the world, when it talks about terrorism, and imagine the level of preparation and so on is immense. To be honest, a virus is more powerful in creating political, economic and social upheaval than any terrorist attack.
At the conference today, they gave the virus a name, Covid-19, coronavirus disease. By tomorrow afternoon, there will be a blueprint, mobilizing the response, putting together a research agenda, finding new drugs or even using older ones developed for other reasons.
I mean, it will be a constant learning, but I'm sure in 2 months we know more than we know right now. You also know that some of the antivirals, so medicines, are currently tested in China, and I'm hopeful that one of these medications may have an impact, which will be very interesting.
This is urgent. Nearly 43,000 confirmed cases in China and now more than 1,000 deaths, outstripping the fatalities from SARS in the early 2000s. Yet within the desperation that is this epidemic, there is also valuable information.
Because we already have 40,000 people who have been diagnosed. So just doing an in-depth study of those clusters, those families, those communities would already give us a lot of information about transmission. So I think that's really a critical and a very important early question that we want to answer, because that will inform the public health control efforts.
Outbreaks on board cruise liners help provide more information. The Diamond Princess has 135 confirmed cases so far. In Hong Kong, residents were removed from an apartment block after 2 people living on entirely different floors tested positive for Covid-19. And the UK businessman being treated in London, who appears to have passed the virus on to 11 people, is also of interest to the WHO.
Dealing with this disease is a marathon, not a sprint. The situation will get worse before it gets better. We will be guided by the science. Be in no doubt, we will do everything that is effective to tackle this virus and keep people safe.
The fact is, there are still only 393 cases outside China in 24 centres. The epicentre remains Wuhan and the Hubei province in the centre of China. Despite building 2 highly publicised hospitals and opening beds in conference centres, they are running out of places to put the sick. The medical staff are under the most intense pressure as the country battles to contain Covid-19 from becoming a global pandemic.
Victoria MacDonald in Geneva. Now, Aisha Tal is in Brighton with more on the British businessman thought to have passed the virus to at least 11 other people. Aisha.
Well, yes, as the day's gone on, more and more has been revealed about Steve Walsh, the businessman and scout leader in Hove that's been at the centre of this. Now, earlier today, he sent a statement. I'll just read a little bit out for you. He said, "I'd like to thank the NHS for their help and care. Whilst I have fully recovered, my thoughts are with others who have contracted the coronavirus. When the diagnosis was confirmed, I was sent to an isolation unit in hospital where I remain as a precaution. My family was also asked to isolate themselves. Now, the big question here in Brighton, but also elsewhere as well, has been, should this man have been identified earlier? Now, the World Health Organization said they were deeply, deeply unhappy that he was identified, but a councillor I spoke to here earlier said that more information a little bit earlier would have been helpful.
I don't think from day one we got the full picture of how quickly this can develop in time, and we've certainly seen in the 5 or 6 days that the story has broken, that the trickle of information is probably hindered rather than helped.
Now, council leaders at a press conference earlier argued against that. They said that they worried about stigma and also patient confidentiality.
I think one of the important things to emphasise here is about patient confidentiality as well. So Public Health England have been leading on this, so we've been taking and following their advice, but I think it's absolutely irresponsible of anybody to reveal the names of patients in the media.
Now, just a little bit more about the situation in Brighton that we've seen since we've been here. 3 GPs have been closed. 2 of them are set to reopen tomorrow, and they've been deep cleaned. And also 2 schools have had staff that have self-isolated themselves, so they haven't gone in. But parents have been told that if their kids are off sick, then it won't be an unauthorised absence. And just beyond Brighton as well, there have been 2 prisoners at HMP Bullingdon from Oxfordshire that are being tested for the coronavirus, and they've been isolated as a precaution.
Aisha Tal in Brighton. Well, joining us now is Professor Stephen Riley. He's at Imperial College London and a member of the Scientific Pandemic Influenza Group on modelling, which advises government on the UK's response to the coronavirus. Professor, I'm wondering, this far in, can you track the dynamics of this thing, and is it behaving roughly according to plan?
It right now is a difficult time. We've observed a really sharp rise in cases in China, and then perhaps a little bit of a slowing down, and these international cases. But we've not yet observed it taking off outside of China. So we're seeing these sporadic small clusters, but they're not taking off. So we're very much at a wait and see kind of stage in terms of the global picture.
So this country is basically at the moment looking at super spreading only, and not kind of a mass influx.
That's right. So as concerning as these reports are for people, especially people living in Brighton and people associated with the cluster in the Alps, as concerning as they are, this is a cluster that we can trace completely. We know it goes back to a conference centre in Singapore, and we've traced all these contacts. The new cases are appearing from the contacts that we found. So it's concerning, but we're still at that early stage if it's going to take off there.
What is the danger that this virus, which after all you've never seen before, you may have seen its like, but you've never seen it before, will evolve into something much worse?
That's always possible. Viruses change all the time. If you're infected by flu, it's a little bit different than the strain that infected your child or your partner. They change all the time. The rare thing is a really substantial change that changes the properties of the virus, and they are actually quite rare. It could happen, but to be absolutely honest, as a scientist, we've got more important, difficult things to figure out, and that's very it's very hard to get a handle on that kind of thing.
Now, the Health Secretary was quite candid. He said things will get worse before they get better. What does worse mean, and what do you think worse is?
Well, I think worse at the moment means there are many cases in China, and we're watching small clusters all over the world. So here we would expect to see some small clusters of cases. And then what we're worried about is the possibility that it starts to transmit here. So I'm sure he means that we have to watch and wait and see and look for these signs that it may take off. But we don't know for sure that it will yet.
The world is a kind of system of winds and all the rest of it, and the circulation of the globe itself. Is that a factor, and can you predict it through that?
At the global scale, we can kind of predict it, but it's people. It's not the winds or the tides. To travel long distances, the virus has to get into one of us and get on a plane. We kind of know that.
Is it certain that it will take as long as a year and a half to find a vaccine, or could there be a breakthrough?
I'm sure a breakthrough is possible, but a year and a half to get significant large stocks of a brand new vaccine would be an incredible achievement. It's not coming up with the actual vaccine itself. It's testing, validating, manufacturing.
Professor Riley, thank you very much indeed for coming in.